Hi, my name is Maria Rebozo Lapine. Welcome to our Cafecito Time con Equality Health Studio. And I'm so excited today because today I have Dr. Nilam Khurana, board certified pediatrician and co-founder of Healing Hearts Pediatrics. In this segment, Dr. Khurana will talk about getting our children ready for school, whether it's your kindergartner or like me, our teen who wants to play school sports. And why is it important to schedule a well-child visit with your doctor before school starts? It's not only a good time to look for great deals on school supplies, but it's also a good time to take a look at our child's school-related health checklist. And of course, while you're listening to our Cafecito today, remember to subscribe to our YouTube channel so you'll know when our next Cafecito video is ready to view. Doctor, welcome.
Thank you so much for inviting me to talk.
I am so happy to have you here. I know that you are so busy, but I know that you have such a huge commitment, not only to your patients, but to the community. And that's why you accepted to be our guest at our Cafecito. So thank you so very, very much. We have a lot of information to cover, so I want to get started right away. The first question I want to ask is, why is it important to schedule that child visit before school starts?
So it's extremely important for them to go into their physician before school starts so that they can get ready and be fully ready for success for the coming school year. We are checking so many different things for them, and we want to make sure that they are going to be successful with the challenges that are going to come this next year.
You know, what takes place during that visit, during that doctor visit?
So typically, no matter what age the child is when they come in, we have them fill out questionnaires in the waiting room. So they're basically just simple questions so we can get an idea of where the child is emotionally, developmentally, and figure out what else is going on around them in their environment at home and outside of home. And then we do a full physical exam. We want to make sure that everything's okay. Especially now because of COVID, there's other things that could be happening in the child's body that we really want to address. So for example, if they got the infection, they may have a higher risk of heart conditions. And so we want to make sure that all of this is checked so that they're ready to be successful in school.
You know, as a mom, I am your typical mom. I always say this in my cafecitos, but I don't think about taking my son to the doctor unless he's sick. So why are they important? Besides the fact that I know it's an opportunity for me to have a one-on-one with the provider.
It's extremely important. Every year, children are growing and changing constantly. And there's so many children, you're not alone, that missed their well visit in the last year because for various reasons, were not able to come in for their well visit. And some of the kids I'm finding have been having many other issues that we weren't able to address. And of course, I wish they had come in a year ago so we would have been able to prevent some of those problems. But we're looking at kids who are underweight, overweight, not growing to their full height potential, and especially lots of mental health issues, which have really skyrocketed in these last 2 years, unfortunately, due to the pandemic.
Yes, you know, when I was getting ready for this cafecito, I realized that I hadn't made the doctor's appointment for my child. And when I called to schedule it, I realized it has been 2 years since the last time my son had been there. So this is a really great time to really make this a reminder to schedule that yearly visit. Like she said, it's a great opportunity for us to really share any concerns that we might have and have that one-on-one with our providers. I do want to talk about mental health because I know that our culture, my culture, the Hispanic community, we don't like to talk about it, but I know that mental health is important. And can you tell me about how do you deal with that? How do you talk to the parents and what do you look for?
So it's not only your culture. I'm from India and our culture has the same issue and many other cultures do. People don't like to address mental health issues. Unfortunately, a lot of times it was made to be something that wasn't real and people didn't believe the truth in it and the actual true medical science behind it. But now what we found is that these children and adults who have fear. And unfortunately, this last 2 years has been very fear-provoking for so many children, that creates hormonal changes in their body that then creates all these ripple effect of problems for them. More fear creates more responses, and unless it's addressed early, it can cause even many medical issues that people just don't realize. And we're determining this earlier now and hoping to reach out to children and families to help them understand the importance of talking to their medical provider. We are trained to learn how to bring this out of children. Many children don't talk to their parents about what's going on, mainly because they don't know how to, and many parents don't talk to their children because they don't know how to. So when they come in and we have them fill out a screening questionnaire, we're asking them specific questions that can be signs of them feeling sad, depressed, anxious, all of these things. And then we talk to the children directly. I found that the questionnaires are so helpful because I will ask a child a question verbally and they will say, no problem. And then they fill out the questionnaire and all of a sudden it's like, I'm having this harmful thought every day. And so it just opens up the ability to have these conversations, and kids want to talk to somebody. This is a great opportunity for them to talk to somebody that they trust and their parents trust so that we can help that child.
You know, you said the magic word. The magic word there, that they should have someone they trust. That provider that you have for your child or for yourself should be someone that you trust. If you don't have that trusting relationship with your providers, reach out to us at Equality Health because we can help you find another provider, one that connects with you and your child. You know that I know that you have some YouTube channels of your own where you provide a lot of education on autism and dyslexia. Can you tell us a little bit about it?
Yes, so actually I started this during the pandemic because I found so many children having problems, and the isolation has made it so difficult for parents to even know where their child should be, provide them the development. When they say it takes a village, it really does, and there's so many people that help these child develop and grow, and that part being missing had caused many delays in children. And so I started the YouTube channel talking about all areas of development, including social emotional development, to help parents be able to see if their child is needing help. Because the earlier you find out that something is going on, the sooner you can actually help them. Their brains are molding throughout their childhood. Until they're into their early 20s, they're still growing and learning how to deal with all the stressors as well as catch up from any delays that they're having. So we want them to have these opportunities, as well as learning disorders for children in school. Many parents don't know about it. Many doctors don't know about it. And so I am going to continue to provide lots of information for families because I feel it's very important for families to have easy access.
And where do we find your YouTube channel?
It's called Baby 101 with Dr. Khurana.
And I want you to know that I have looked at those YouTube channels, and she does it in a way that I understood every single word that she said. So thank you for doing that, because I think sometimes a lot of providers speak in a language that we just don't understand, and you don't do that. Doctor, I want to thank you so much for being here with us today. We're running out of time, and there were so many things that I wanted to cover. So thank you for being here with us today. And I want to thank you for being here with us today as well. Remember, make this a regular time to schedule that wellness visit with your providers. Something that we didn't cover was that 1 in every 4 children have vision problems. So make sure that you schedule an appointment with your eye doctor. Again, thank you for joining us today, and cheers to staying healthy.